Tomorrow marks 1 year since the World Health Organization declared we were in the midst of a global pandemic sparked by the coronavirus. Since then, people across the world have dealt with tragic loss and social isolation. So I'd like to bring in Dr. Geri Lynn Utter. She's a psychologist who's joining us to talk a little bit more about the mental health impact of this pandemic. Thank you so much for joining us. And part of the reason that we are talking about this now, we've talked about this before, but now it's significant because, as we mentioned, it's been a year. I've had a number of conversations with people who have looked back. You know, where were we a year ago? A year ago, I thought I was taking 2 weeks to work at home because 2 weeks was the incubation period for this virus, and we were just learning about it. I figured I'd be back in the studio. Could have never comprehended that it would be a year later. And so, this is a time when people tend to sort of look back at all that has happened. And so sometimes these special dates, for lack of a better word, can be emotionally challenging. Can you talk about a little bit about why that is?
Yeah, so usually when you talk, what's interesting about the pandemic is when you talk about traumatic events, there's an anniversary because the traumatic event has come to an end. What's interesting now is that though there's light at the end of the tunnel, though we're starting to kind of navigate through this, we're still in the crux of something traumatic that's happened to us. So I think the one thing that we really want to be aware of, because we're not technically at an anniversary at the end of an event, we're still in it, is to really just practice a lot of self-compassion, being kind to ourselves, being aware of our mood fluctuations and understanding that there is a level of normalcy attached to that. And then also, reach out for appropriate supports. It's not the same where we could go out and maybe feel comfortable having dinner or go to parties and do things as a group to heal. Because with trauma, typically you will reach out to a support system, be able to do something in person and heal, but it looks a little bit different now. Not to say it doesn't exist, but it looks different. So reaching out for support, in other ways through digital platforms, maybe a one-on-one type of exchange is something that can continue to help us heal and to move forward.
Yeah, and depending on where you were when this all started, sort of emotionally and mental health-wise, it's going to have a different sort of impact on you. So a study published in JAMA Psychiatry last month found emergency department visit rates for mental health conditions and drug overdoses were higher from mid-March to October 2020 than during the same period in 2019. I remember, I think recently, either reading an article or listening to a podcast, particularly about drug addiction and how, yes, many of these people who are recovering from drug addiction sort of continued their regular meetings online, Zoom meetings, but there's something very different about gathering with your support system via Zoom versus, that weekly ritual of going to, a church basement, sitting in a circle, being there in person. So when you hear about sort of that spike in mental health sort of issues and also drug overdoses, what do those numbers tell you?
Yeah, well, it breaks my heart because working with people who struggle with substance abuse disorders is my specialty. It's a population of people that's very near and dear to me. So what I see is that we as human beings crave human contact. We like to be in front of each other. We like to be around each other. You're absolutely right. There's digital platforms, there's Blue Jeans, there's places where you can participate in a Zoom meeting. But what the pandemic has done for people who struggle with substance use disorder and even other severe mental illness prior to it is it's exacerbated it. It's taken it to a different level because we have been stressed to our max. People who struggle with substance use disorders typically have a history of poor coping strategies. So now when you put the pandemic and the pressure of the pandemic, job loss, grief, and all of that together, it kind of tees somebody up for relapse because they revert back to their old ways of dealing with stress through using. So that's what we're seeing. We're seeing a response to the event and dealing with things in a poor way, poor coping strategies, and using to kind of numb out from what's going on around us. And again, people who struggle with substance use disorders, they've always done this and they've gotten clean time and they've done well, but this has kind of stressed them to the max. And because it has stressed them to the max, they revert it back to old ways, if that makes any sense.
Yeah, That makes a whole lot of sense. We know sort of worldwide this pandemic has killed 2.6 million people, nearly 530,000 people just here in the U.S. But, you know, for a lot of people, they didn't have a loved one who has succumbed to this virus. They managed to keep their job. Yes, they are socially isolated, but maybe they have, you know, close family members within the same house. But still, there is sort of a daily diet of loss that you consume, whether it's online through social media, whether it's watching the news. I know for me, it almost seems like my Facebook timeline it almost feels like an obituary sort of list at times. And it's not just because of the coronavirus, but I have sort of the ability to access the loss of not just my friends, but my friends' friends. So it's sort of always coming in. Could it make sense that you could still sort of feel traumatized by the last year, even if you personally don't know anyone who died, didn't lose your job, and by and large your life is intact?
Absolutely. So that's what we refer to as a vicarious trauma. It's kind of a vicarious trauma because we are collectively still experiencing it or still exposed to it, even though we haven't been directly impacted. So absolutely, there is a response that can occur, and you can still be impacted if you didn't have a close family member or loved one, or you didn't lose a job. And a lot of that has to do with what you touched upon, which is, in today's world, we have such access to so much information that's right at our fingertips. And though there's a lot of positive things about that, sometimes it can be negative, because if you're scrolling on social media and you're constantly consumed and you're hearing about all of these terrible things that are happening, even if it's twice or three times removed, and then you go and you decide to put the news on, which is great, but taking it in small chunks and consuming your information via, you know, different media outlets in small chunks is really what's important. Because for myself, when the pandemic started, I had, you know, the news on in the background through my whole work day. And it actually, I noticed in myself the anxiety, and I started to feel fearful, and I started to feel helpless. And that is a trauma response. So what I did to take care of myself is I limited the amount of media, social media, and traditional media outlets to the information I needed, and then kind of moved on, because you can, you know, experience a traumatic impact and increase anxiety, feelings of helplessness, if you constantly expose yourself to negative information.
Yeah, you know, Doctor, as you're speaking, I was thinking, like, it's sort of a little bit of a put yourself on a media diet. And I thought, it just follows the arc of the pandemic, how, you know, when all of us were at home working, many of us were eating more than we normally would. And then we realized we need to course correct and scale back on food, and perhaps even sort of scale back on the media a little bit too. Not CBSN, of course. You're just watching us every morning, but
I love that media diet. I'm going to use that. I love that media diet saying. So thank you for that.
You may have that. Dr. Geri Lynn Utter, thank you so much.
Thank you.
So listen, if you're feeling that you or anyone you know may be struggling during this time, you can call 1-800-273-TALK to speak to someone at the National Suicide Prevention Lifeline.